If you had to guess when most heart attacks happen, you might picture a stressful moment at work, a big meal, or the middle of the night during sleep. But decades of research point to something different. The hours between roughly 6 in the morning and noon carry a substantially higher risk of heart attack, cardiac death, and stroke than any other stretch of the day. This isn't a minor statistical quirk. It's one of the most consistently replicated patterns in cardiovascular research, and understanding why it happens gives you real, practical ways to lower your own risk. Let's walk through what the research actually shows, why your body is built this way, and what cardiologists specifically recommend for the first part of your day. How much higher is the morning risk, really? A widely cited analysis pooling data across many studies found that between 6 a.m. and noon, the risk of heart attack is about 40% higher, the risk of cardiac death is about 29% higher, and the risk of stroke is about 49% higher, compared to what you'd expect if these events were spread evenly across the 24-hour day. A more recent review in the European Heart Journal put the morning increase in heart attacks at roughly threefold higher than late evening. To be clear about what this means and doesn't mean, this is a pattern across large populations, not a guarantee about any individual morning. Heart attacks happen at every hour of the day, but the concentration of risk in the morning hours is real, well documented, and important enough that emergency medical services and hospital staffing patterns are partly built around it. What's actually happening inside your body each morning? This isn't mysterious or unexplained. It comes down to your circadian rhythm, your body's internal 24-hour clock, and how it manages your cardiovascular system while you sleep and as you wake. While you're asleep, your body runs in a lower power state. Heart rate slows, blood pressure drops, and your whole system essentially idles overnight. As morning approaches, even before your alarm goes off, your body starts preparing for activity. This involves a coordinated surge of several things happening at once. First, your levels of cortisol, a stress hormone, are naturally at their daily peak in the early morning hours, as part of your normal circadian pattern. Second, as you wake and your nervous system shifts out of its overnight rest mode, adrenaline increases, which raises your heart rate and causes blood vessels to constrict. Third, blood pressure itself follows a circadian pattern and rises sharply in the morning, a well-documented phenomenon researchers call the morning blood pressure surge. Fourth, your blood becomes somewhat more prone to clotting in the morning hours, partly because platelet activity, the blood cells responsible for clot formation, follows its own daily rhythm and is more active around this time. Fifth, research on the endothelium, the thin lining inside your blood vessels that controls how well they can dilate, shows that this ability to widen and relax is at its lowest point in the morning, meaning vessels are less able to accommodate that sudden rise in blood pressure. Put together, you get a rise in blood pressure and heart rate, blood that's more prone to clotting, and blood vessels that are less able to flexibly respond to the increased pressure, all happening at the same time, every single morning, as a normal part of your biology. For someone with healthy arteries, this transition happens smoothly and causes no problem at all. But for someone who already has narrowed arteries or unstable plaque, the fatty deposits that can build up inside blood vessel walls, this coordinated morning surge is exactly the kind of mechanical and hormonal stress that can trigger a plaque rupture, leading to a clot that blocks blood flow to the heart. That's the acute event underlying most heart attacks, and it's disproportionately likely to be triggered during this specific morning window. Why this matters more if you have existing risk factors. This pattern doesn't mean every person needs to fear waking up. It matters most for people who already have one or more of the following: high blood pressure, known coronary artery disease, diabetes, a prior heart attack or stroke, high cholesterol, or other established cardiovascular risk factors. If your blood vessels are already narrowed or your blood pressure is already poorly controlled, the normal morning surge is a bigger relative jump on top of an already strained system. This is also part of why cardiologists pay close attention to how well blood pressure medications cover the early morning hours specifically, since some blood pressure medications wear off overnight and leave a person unprotected exactly during this higher risk window. This is a real, individualized medical question, not something to adjust on your own, but a good one to raise with your doctor if you take blood pressure medication and want to know whether your specific prescription and timing accounts for the morning surge. What cardiologists actually recommend for your morning routine. None of this is about avoiding mornings, which obviously isn't practical. It's about a handful of specific, low-effort habits that several cardiologists consistently point to as reasonable ways to ease that transition and reduce unnecessary added strain during the highest risk window. Don't jump out of bed immediately. Give yourself a minute or two sitting up before standing. rather than springing straight from lying down to standing. This allows your blood pressure and circulation to adjust gradually, rather than being asked to compensate suddenly, which matters especially if you're prone to any dizziness upon standing, a separate but related phenomenon called orthostatic hypotension. Avoid intense exercise immediately upon waking. This doesn't mean you shouldn't exercise in the morning. Regular exercise is one of the best things you can do for long-term cardiovascular health. It means giving your body some time to fully wake up before jumping into a high-intensity workout, rather than going from a cold start straight into maximum exertion. Be mindful of caffeine timing and amount. Caffeine activates your sympathetic nervous system, adding to the natural morning surge in heart rate and blood pressure that's already happening. This doesn't mean cutting out your morning coffee entirely for most healthy people, but it's worth being aware that stacking a large amount of caffeine directly on top of your body's own natural adrenaline surge is doing exactly what it sounds like, adding more stimulation on top of stimulation your body is already producing. Stay hydrated after waking. Several cardiologists specifically recommend drinking a glass of water shortly after waking, since overnight fluid loss can thicken the blood somewhat, and adequate hydration supports healthy blood viscosity and circulation. Support your circadian rhythm generally. This sounds abstract, but it has concrete pieces. Getting some natural light exposure early in the day, keeping a consistent sleep and wake schedule, and avoiding bright artificial light close to bedtime all help keep your internal clock properly regulated, which in turn supports more predictable, gradual hormonal transitions rather than abrupt ones. Manage stress as you start your day. Since cortisol and adrenaline are already naturally elevated in the morning, adding a stressful, rushed start on top of that is compounding what your body is already doing internally. A few minutes of slow, deep breathing, or simply not treating the first moments after waking as an emergency, can meaningfully ease that transition for your nervous system. The warning signs worth knowing, especially in the morning. Because risk is genuinely elevated during this window, it's worth being familiar with the classic warning signs of a heart attack: chest pressure, squeezing, or fullness rather than sharp pain, often extending to the arms, neck, jaw, or back. Sudden shortness of breath without exertion, cold sweats without an obvious cause, and unusual fatigue or lightheadedness. In women, symptoms can sometimes be less classic, including unusual fatigue, nausea, or back or jaw discomfort without prominent chest pain. If you or someone with you experiences these symptoms, especially in the morning hours, the appropriate response is to call emergency services immediately, rather than waiting to see if it passes. Time matters enormously in how well the heart muscle can be protected during a heart attack, and delaying care meaningfully worsens outcomes. The concentration of heart attacks, cardiac death, and stroke in the morning hours is a well-documented, biologically explainable pattern, driven by a normal but significant daily surge in cortisol, adrenaline, blood pressure, and clotting tendency, combined with reduced blood vessel flexibility during that same window. For people with healthy arteries, this transition is simply part of being human and isn't something to fear. For people with existing cardiovascular risk factors, it's a meaningful reason to talk to your doctor about whether your blood pressure medication adequately covers the early morning, and to build a handful of small, low-effort habits into your morning routine: waking gradually, moderating morning caffeine and intense exercise, staying hydrated, and keeping a consistent sleep schedule. None of this replaces your prescribed treatment or regular medical care. It's a set of reasonable, evidence-informed habits that work alongside it.